Hello, welcome to The Wild Show. This is a podcast done by people with learning disabilities for people with learning disabilities. My name is Emily and I'm joined here with my two guests.
Hello, I'm Teresa. I'm a learning disability liaison nurse working for the Health Board.
And my name's Amy. I'm also a learning disability health liaison nurse working for the Health Board.
Now, our next topic is birth control. So what is birth control?
So it's something to take or use to stop you getting pregnant.
What are the different types of birth control?
There's lots of different options, and so I'm going to just talk to you about the most common ones, and you probably heard of most of these. Condoms are probably, probably you've heard of condoms, and they're most commonly the male, the man wears the condom, but using condoms is also good for preventing sexually transmitted infections as well. So that, as well as stopping you getting pregnant, they're also good for preventing sexually transmitted infections. There's also something called the pill, or the combined oral contraceptive pill, as it is, and that's a tablet that you take daily to stop you getting pregnant. And it depends which type of pill, but usually you have a break after 3 weeks and have a week off. But there are different types of pills where you don't have a break. The thing with the pill is that you've got to remember to take it. So if you're not very good at remembering to do things, to take tablets, that's not always the safest way to stop you getting pregnant. So maybe think about some of these other things. So there's the contraceptive implant, and that's a small flexible plastic rod. It's placed under the skin in your upper arm. Obviously that's done by a doctor or a nurse. And basically it works by releasing the hormone progesterone into your bloodstream, and that stops you getting pregnant, and it lasts for about 3 years. So after 3 years you sort of go in and have the implant taken out, and then another one put in. And there's also the contraceptive injection, so that also releases the hormone progesterone into your bloodstream to stop you getting pregnant, and it lasts for about 13 weeks. So every 13 weeks you've got to go in again and then have another injection. And I suppose the other one, which is quite common, is the intrauterine device or system, IUD or IUS. So I think sometimes it's called the coil or the copper coil. So that might be something that you might have heard of. And it's a small T-shaped plastic and copper device, and that's fitted into your womb by a doctor or a nurse, and it releases copper to stop you getting pregnant, and that lasts for about 5 to 10 years. So obviously that's after 5 or 10 years, we know it needs to be changed again. But also the coil or the IUD, IUS can also be used if you get heavy periods. If someone gets heavy periods, then sometimes that's used also to help with that, to help make the periods less heavy. So because it can ease the blood flow, and obviously and like the discomfort that we talked about earlier on as well.
What are the side effects of these?
So as we've seen with lots of our answers, there are quite a number of different side effects that people can experience. So not everyone will experience all of these, but these are just some examples. So all of the different types of birth control that Teresa mentioned, some of which can make your periods irregular. They can often appear lighter in flow, or sometimes even stop. Or it can be the opposite, actually, and it can make your periods seem a lot heavier. There also may be some breakthrough bleeding or spotting. So that's when you've already had perhaps your normal monthly cycle, or your period. And then in between that, when you're not expecting to see any blood at all, you may just see some light fresh blood on your knickers or something like that. And that can be seen when perhaps maybe you're just starting off with the pill. It's quite common to see that. The pill can also cause mood swings, so you can be particularly quite grumpy until that pill gets into your system and is used to being within your body. It can cause headaches and nausea, but again, that should pass after a couple of months once you've started taking it regularly. There's also an increased risk of some cancers. I think particularly breast cancer with a certain type of the pill. You can also experience weight gain, which is quite common, I think, with a lot of people. There can also be a chance of increased blood pressure. And also we can't forget that, if you're not using any other protection, such as condoms, then there's also still a chance of getting a sexually transmitted infection. And also, of course, condoms are quite fragile. They're only made of light rubber. So they can also split very, very easily if they're not handled carefully. And obviously that can, potentially lead to infection or even pregnancy. And there's also, because condoms are made of rubber and latex, and some people have allergies towards that. So if that's the case, there are other alternatives that you can get from the pharmacy. You just need to go and speak to them to find out which one would be best for you.